Good afternoon, and thank you for joining me for our final leadership rounds of the year. I'm Dr. Mindy Estes, President and CEO of the St. Luke's Health System in Kansas City and Board Chair of the American Hospital Association. This week, I'm pleased to introduce Dr. Rod Hochman, President and CEO of Providence, a comprehensive healthcare organization serving patients across 7 states and headquartered in Renton, Washington. The Providence team includes more than 120,000 caregivers, serving 51 hospitals and more than 1,000 clinics, providing more than 1 million home health visits, along with other health and social services. Providence is pursuing innovative ways to transform healthcare by keeping people healthy and making services more convenient, accessible, and affordable for all. Rod is the past chair of the Board of Trustees for Catholic Health Association, and in 2019 was the recipient of the Gail L. Warden Leadership Excellence Award by the National Center on Healthcare Leadership. That was an in-person celebration. Finally, I'm pleased to share that Rod is also chair-elect for the AHA Board, stepping into this role, which I'll be vacating next month. Thank you, Rod, for joining us.
Great. Well, it's great to be here, Mindy. And what we both say is this has been quite a year, right?
It has been quite a year, so let's just jump right into it. With new record-breaking COVID numbers being reported around the country every day in recent weeks, how's Providence battling the third wave?
Sure. So, we're in 7 states, so we watch the waves go. And I was just on a call early this morning, and we're seeing our numbers go through the roof in Southern California. And I got the report that we have 1,000 COVID patients in our hospitals in Orange County and Los Angeles. The good news is that it seems to be leveling off in Oregon, Washington, Montana, Alaska, Texas, and New Mexico. So we're starting to see at least some flattening of the proverbial curve there. But this is just ongoing. And we felt a moment of joy as we're starting to vaccinate our first caregivers, and psychologically, I think that's making us feel better.
Agree. It's the beginning of the end, I think. At least we're hoping. If you look at the challenges, this whole pandemic has been about staffing, testing, and stuff, which is, sort of PPE. What do you believe we should be preparing for the next several months?
Well, I think the biggest concern that I think probably keeps you and me up awake at night and all our colleagues out there is, how do we get our caregivers through the next few months? And I think that's been the thing that has had the highest worry for us. Will we have enough staff? We're looking in Southern California how to take clinic staff, retired nurses, retired doctors, and get them back out there. But the real concern is can we make it through and keep our staff functioning, able to do what they need to do? So I think that's probably number one on our list. I think we can almost cover the space issues, the supply issues, all of those seem okay, but it's the staffing issues that are the biggest concern.
Yeah, I would agree. I mean, it's not only numbers of staff, but also this notion of COVID fatigue. And, do you have any examples of the way you're working to increase resilience with your frontline caregivers?
Right. So we were really concerned, on one end of the spectrum, and so sorry that over the last 2 to 3 months, we had 5 suicides of caregivers. 3 were physicians and 2 were nurses and assistants in Oregon and California. And we had been on this before about looking at the stress levels. When we went to our 120,000 caregivers, over 30,000 responded to inquiries about getting services to deal with the stress of the pandemic. So we've been putting professional services out there for all of our caregivers. And then the other thing that we've been doing is really having our caregivers taking care of ourselves. So we had a meeting of all of the emergency room and ICU physicians in Oregon to kind of talk about what the issues are, to really give some, collective therapy to the whole group, but really kind of looking at this in a way. So we're going through state by state, really being able to provide some of those services. We've got a model from the UCSD in California as a great model looking at, stress relief for caregivers. So we've been doing a tremendous amount of that kind of work. So that's really where our focus has been, and getting our leadership out there, really understanding what our caregivers are going through.
Yeah, I mean, it's important to talk about it. I mean, and that's the first step. And I think so often in healthcare, we believe we have to be strong, and it is a sign of weakness to talk about it. So that's the first hurdle, is to begin to understand that we're all stressed, we're all tired, and let's verbalize that. And there are ways in which we can help.
Exactly, exactly. And I think it's all of the other stresses that are going on. I mean, nurses and doctors, their kids, who's taking care of them at home, what are the financial stresses on families that are out there. And we also think a lot about our caregivers in terms of our environmental services folks, our dietitians, our food service folks, who every day are putting themselves in harm's way to do the work that they've signed on to do.
You know, this holiday season, it's really important to emphasize COVID prevention measures. And how are you encouraging your patients and neighbors to become part of this solution?
Well, we're trying to, not that we want to guilt people into it, but guilt is a strong force in the universe. But we're really trying to getting to understand that staying safe, with the things we've all heard numerous times, but particularly during the holiday season, staying within their bubble and not going out, having big family get-togethers and all the types of things that we know are incredibly dangerous. We've tried to say, what we've said before is, how do you care for your caregivers? The way you can care for them is to really practice safe practices, and particularly at the holiday season, to stay home and do that. I think that in the past has been a powerful message for the public. So we've been using what I would say a little bit of guilt, but it's the right thing to say, that if you really care for your caregivers, stay home, take care of yourselves, and try to, at least for this holiday season, make it a virtual holiday season is the best and most safest way to do it.
Have you had different approaches between the rural areas you serve and the urban areas?
It's been hard all over because, a lot of our folks, what we've noticed initially, our high density COVID areas were in our more urban settings. But subsequently, in this wave that we're going through, we've seen, almost, universal spread, particularly in our rural areas.
Hmm.
But the problem is there's a sense of isolation on a good day. When you're out in Eastern Oregon or Eastern Washington or parts of Alaska, if you're in Kodiak, Alaska, you're feeling isolated on a good day. And that's the problem that they have, is that some of these things, these social events, are really lifelines for folks, and we're telling them that they have to, stay away. We've been particularly, in particular rural settings, worried about our senior population, that we're saying stay home, stay safe, and do that. But from a morbidity and mortality standpoint, you and I both know that social isolation, particularly in some of those settings, is really difficult for a lot of our people.
Yeah, we've seen tremendous spikes in the rural areas of Kansas and Missouri, and groups of folks who really thought that COVID was a city problem, and now really is a rural problem. And then when you have, positivity rates of upwards of 50%, very, very difficult to deal with, and very difficult to message.
Absolutely, and I think that part of it, and I think what both of us as physicians feel, the varied responses of different people. We just had a close colleague of ours, his brother, 4 days after contracting COVID, died. And we see young people that have some of those responses, some folks that do well. So what we try to impress upon people is that, the immunologic response is so varied that whether you're 18 or 90, we can't predict how ill you may become. There's a sense of invincibility, particularly among some of our younger populations, which isn't necessarily true in terms of what we're seeing clinically.
So let's turn to something more hopeful. A handful of vaccines are now going through the stages of FDA approval. The Pfizer vaccine just received an EUA, and probably Moderna later this week. What are you doing to prepare all of your staff for the vaccine, and what communication and education efforts are you using to employ a smooth inoculation strategy?
So we had 300 people on our call this morning from 7 states. And then, Mindy, as we all know, each state has a little different nuance in terms of who's getting it, how is it distributed and where's it going. But our people have been all over this, and they've been really working closely with the state and local governments, understanding where are our sub-zero freezers, how are we going to do it. And I was so impressed that down to the individual, we've put together for, we have 120,000 people that work for us, but when we include volunteers and everyone else, I think it was 210,000 folks are filling out a form so we know where they are in terms of priority for getting it, so that we can really document who's getting it, when they're getting it, and where are they getting it. And then we also had on our nursing home people, and they're working both with our hospitals, but also with other distribution places like CVS and how that's going to get done. And so that some of the vulnerable populations, particularly in the nursing home population, are there. So my recommendation is get a plan. It's like a military operation. But I came away from my call saying that, our state, our local, all the way down, really have a sequence to how this is going to get done, where it gets done. And I think psychologically, just getting the first, a few 100,000 people vaccinated is going to make a real difference. But you really have to get down to the specifics. In a lot of cases, a lot of our colleagues have gone through trial runs of how the vaccine gets distributed, particularly in some of our rural places where it's tricky, because the half-life once it's out of sub-zero is limited. So also the recommendation that you go through trial runs, you kind of making sure that we don't vaccinate a whole ICU staff all at the same time, particularly with the second vaccination, where there's more of a chance of side effects with the second dosage. We don't want the whole ICU to have a fever and really wanting to have to stay away while they're going through that. So those are all, the list of do's and don'ts, and who gets it, who doesn't get it, all the issues around personnel that may be pregnant. So it really requires that. But I felt better. I would ask all of your incident commanders to be on top of this, and I know that's some of the work that's being done. You cannot prepare enough for this.
I couldn't agree more. And we've done tabletops and all kinds of things. And we think of something every time we do it, and there's a gap that's there. And I, like you, I'm convinced that if you've seen what's happening in one state, you've seen what's happening in one state.
Exactly.
That there really is very little overlap between you're in 7 states, we are in 2, and they could not be more different.
Yeah, exactly.
I know that this was not the year that you and I anticipated, and the way we were spending our year as chair and chair-elect battling the pandemic and its fallout. But as I reflect, I know that you share my pride at how capable and committed and compassionate our colleagues across the country have been. It has really been truly inspiring, and I'm confident that we will come through this stronger, having innovated and improved not only our patients' health, but the healthcare experience. We still have a ways to go, but to end on a positive note, Rod, are there any innovations you've been proud of this year that you'd like to share? And what opportunities do you think the pandemic has created to rethink and advance the care we provide?
So, kind of, Mindy, as we both know, we're both expecting to dig in on a lot of the caregiver issues around doctors and everything else. Well, guess what? We got COVID. But out of COVID, I think we've changed healthcare forever. So the one that's so obvious is just the virtualization of care. Today, we're still doing 20% of our visits virtually. That's not going to change. I have to go for my annual checkup, and I clicked on virtual, and we're planning that visit that way. So I think the virtualization of healthcare will be something that COVID has accelerated. The second thing that I would say that's most enlightening is how caregivers and researchers have worked together. I've been on calls from researchers from competing institutions, and it's just been so wonderful to watch the way people are working together, sharing ideas, what needs to be done. So the sense of community, particularly amongst all of us in the hospitals and doctors and nurses, I think will hopefully last, way beyond this COVID pandemic. So our ability to work together. The third, what I would say, is the digitization of what we
Yes.
do and understanding how we do that. And then lastly, it's understanding the supply chain matters. And I think all of us have learned a lot about how do we ensure that we have adequate supply chain of even the most mundane items. And like with the program the AHA has done to share ventilators,
Mhm.
why wouldn't we share other resources when there's a hurricane or there's a fire or others? So this ability to cooperate, share together, I think is going to be a legacy of this pandemic that I think organizations like the AHA have really stepped in, done the right thing, and really helped us organize ourselves better.
I agree. I mean, I think we as a field should be proud. It's been a hard year, one that I hope we do not repeat. And I want to thank you, Rod, for joining
Sure.
me and sharing your insight. Your perspective as a clinical leader is always helpful, and clearly the role of board chair is in very capable hands next year. And thank you all one last time to everyone who's joined the leadership rounds this year. As I said when we first began the series, there's great value in listening and learning from one another. And I know those valuable lessons will continue next year as Rod takes the reins of this podcast along with his post as board chair of AHA. I hope you'll all continue to tune in. I know you will. Until then, I know you'll stay busy, but stay safe and be well. Thank you.
Thank you, Nikki.